Plantar fasciitis is one of the most common things I see here in the office, and it's very frustrating for patients, but one quick thing that you can do is stretching, and there's several stretches that are very helpful. So I'm going to show you some that are really good for this. So stretching band, and if you don't have a stretching band, you can also use a belt. Sometimes patients actually prefer a belt because it's more rigid. One way is to put the band right underneath the ball of your foot. So the ball of your foot is right here. And you're going to grab and you're going to keep your knee straight. Keeping the knee straight is very important because you're going to stretch everything. So glutes, hamstrings, calf muscle, Achilles tendon, plantar fascia, they're all connected and they work all together. So you just don't have a tight plantar fascia, you have a tight Achilles and so forth. So it's very important you keep your knee straight because then you're going to stretch everything. Then you're going to grab the band and you're going to pull towards you like this. And you want your foot closest to your head. And you're mainly going to feel it in the hamstring, which is fine, or your calf. And you're going to hold that for 45 seconds. A lot of people also, when they stretch and then 5 seconds. And that's not enough time for your brain to get the signal that you're actually stretching. So when you hold 45 seconds and then you let go, and then you do it again. I know, it feels like it's forever, 45 seconds. And then you let go. So you do that 3 times. Three times in the morning, 3 times at the end of the day, and that will be helpful. Okay, so this one's very similar to the first one, just that we're gonna really isolate that plantar fascia. So instead of putting the band on the ball of your foot, you're gonna put the band on your toes actually. And then you're gonna pull the toes and you're actually gonna feel that pull here on the actual plantar fascia. And so, and again, any stretch you do, 45 seconds, you grab it and you're gonna pull it, and that's gonna really target this area right here. And just like the first one, you're gonna do that 3 times in the morning and 3 times at the end of the day. And if you're at work and you don't have your band and you don't wanna do that stretch, something that's very easy is if you are just sitting, you can just cross your leg and you grab your toes and then you pull towards you like this. Remember, hold for 45 seconds. That will actually help. So when you stand and get up, that would be much, much less painful, which is when usually people have pain. Okay, and something I always add to the stretching, especially at night, is a very cold or frozen water bottle. So this is our frozen water bottle here. And what I have you do is I want you to roll, so all the way back to the heel, and so back and forth. And that is reducing some of the inflammation around the plantar fascia as well. So one that's very, very simple to do if you don't have your band and you're out and about is just touching your toes. Touching your toes will stretch really all your posterior muscle group. And some people are really good at stretching their toes, some are not. So if you can't reach, then just do it until where you can go. And the goal is to get to your toes though. So if you can get to your toes and that's too easy, an advanced one is basically grabbing your toes and pulling towards you like this, and that really will get a good stretch.